Stephen, welcome to my channel, and thank you so much for agreeing to be interviewed and to speak to the audience.
Hi, Robyn. Thank you so much for having me. I really appreciate it.
It's a pleasure. Stephen, you had a very traumatic injury. I would like you to take us back to that day. What happened on the day? What were you thinking, feeling? Unfold those events for us.
Yeah, so it was winter last year, 14th of January, and it was around about 4 p.m. So it was just starting to get dark, and I was in my garden, desperate to finish off some DIY with some wood that I'd been putting off, and I thought, let's just do it. Let's just get it done. I was cutting some wood with a circular saw, a proper circular saw, plug-in, power, and I was on the last cut, and it was starting to get dark, and suddenly the saw just jumped. It hit some resistance in the wood, and it jumped upwards, and I lost control, and my right hand, I'm left-handed, my right hand was to the side of me, and the saw just came diagonally across, and that was it. As soon as I looked down, I just felt this numb sensation go across my whole arm, and my fingers were just hanging by what looked like just a few millimeters of skin. My little finger was fully detached on the floor in front of me, and I just panicked, really. Luckily, my neighbor, we have quite low fences in my garden, and my neighbor's dog was in the garden, and her back door was open. So I just instinctively tried to get some help. I shouted her, and she came out, and she's an elderly lady, and she kind of panicked as well when she saw my fingers just hanging. And she helped me. She called an ambulance for me, and luckily the ambulance was 7 minutes from when they called, and yeah, so
Sure, that really takes us to that moment. Thank goodness she was there.
Yeah, I was very lucky that my neighbor was available and her door was open. I tried to call an ambulance myself on my phone, but the blood was dripping onto my phone screen, so I couldn't tap the screen because it was wet, so I couldn't actually get through to them, and I was panicking myself. I didn't have any pain at that point. It was just shock and numbness. When the ambulance crew arrived to get into my house, they couldn't get in the door, so I was trying to get through my house to the front door, but that's when I felt like I was going to pass out. I didn't pass out. I managed to crawl to the front door and let them in. And so my neighbor, actually, before the ambulance crew arrived, she called her friend from another house on the street who was a first aider, and she came into the house, and she helped me. She got some ice from my freezer, like some frozen vegetables, and she got my little finger, and she was trying to preserve that and to give to the ambulance crew, and she was just comforting me while we waited for them to arrive. But then from when I got to the hospital, that's when the pain started, and I was given everything: morphine as much as possible, paracetamol, all kinds of gas and air, and it didn't affect the pain at all. It was just the most pain I've ever experienced. And then I went into the surgery. They called a hand surgeon in because this was now starting to get quite late, and I went into surgery for 8 hours. And they tried to reconstruct everything. So the flexor tendons, the extensor tendons were all completely severed. The nerve of my index finger was completely severed, but luckily the nerves on my other fingers were intact, and blood vessels. And the bones, of course, were completely severed, so those were K-wired. Yeah.
Sure, that is quite something. And you also had fractures as well.
Yeah. So when I woke up from the surgery at about 6 a.m. in the morning. The surgeon said to me, we've done everything we can. The little finger, though, blood supply to reattach was too damaged. It wasn't a clean slice through the blood vessels. It was more like it's been stretched and then it's snapped. So it's shriveled and gone really difficult to actually sew together with the microsurgery. So they said that the little finger, they think, will most likely not survive because everything else was reattached. The bone was K-wired, the flexor and extensor tendons were done, but they said without the blood supply, none of that matters. So
yes,
the index finger as well was failing to establish a good enough circulation out of it. The blood was coming in, but it was getting congested in the finger and it wasn't removing, so it was just purple. So straight away, within an hour of me waking up, they got medical leeches, and a leech where my fingernail was removed on my index finger, and a leech was put on, and it just sucked the blood through and filled itself up. And when it was full, it dropped off, and then a new one was put on. So it was keeping my finger alive because blood was coming into the finger, but not out of the finger. So it was allowing fresh blood to keep circulating through the finger. So I had leeches on the index finger for 13 days and through the night as well. There was one night where I was being because it only took about 30 minutes for a leech to fill.
yes.
And one night I was having a leech changed by the nurse through the night, which was tough going because every 30 minutes I was being woken up to have a new leech put onto my finger. And the nurse came into my room and said, "Where's the leech? Did you take it off yourself?" And I said, "No." "Where's the leech?" So we were searching my bed, looking for this leech. And it turned out it was underneath the hospital bed, crawling around on the floor. So
Shame.
yeah,
His job was done.
yeah. But the little finger, unfortunately, by the fifth, every morning the surgeons were coming to check to see how the index finger was doing with its circulation. It was still congested and purple every day. But the little finger, by the fifth day, they said it's definitely not survived. You can tell the tissue is dying. So then they took me on the fifth day back to surgery to amputate the little finger, which was really tough. But that was how it is with that one. It was just too damaged.
It must have been a lot going through your mind because you talk to us about your profession and how that.
Yeah, so I'm a classical pianist and a teacher as well, piano teacher. So it was the worst nightmare injury for a pianist and teacher. To affect my hands was my career, really. So it was really, really hard to accept that I didn't know if I would be able to play the piano ever again. When I was in hospital, my main fear was to lose the index finger. So I wasn't so worried about the little finger at that point because my mind was focused on keeping my index finger alive with the leeches.
Yeah.
And then when the little finger was amputated, and I knew that the index finger had survived after the 13th day, that's when my focus shifted to the loss of the little finger and trying to think about how I'd ever be able to play the piano again or be able to, think of a completely new career even perhaps. So yeah, there was a lot going on in my head at that point because everything was very uncertain. Yeah.
Yes, it must have been so hard for you. And when did you begin hand therapy?
So I was discharged on the 13th day, and that's when I was introduced to Gabby in the hand therapy department at Wexham Park Hospital. And she looked at me. She was the senior hand therapist, so I'd been given, I think, to Gabby because I was quite a complex case with all of these injuries that were still really quite fresh, and the bones weren't healed and things. So I had dressings on, and she noticed that there was an infection in my index finger. The healing was very slow, and it was not good. So Gabby referred me to go and get that tested, check if it was infected, and then that slowed down the work that the hand therapy could really do, because there's only, it's balancing the healing of the bones and the tendons with actually stopping scar tissue from forming. Within the first few months, I guess. So Gabby set me a protocol for trying to get the flexor tendons and extensor tendons to work, but without overloading them at the same time. And it was also scar tissue massage when, the healing the actual skin had started to heal properly. And I was spending a lot of time on my hand therapy program at home, sometimes up to 4 or 5 hours a day, just because I knew I wanted to give myself the best chance to be able to go back to the piano and to give myself the best recovery. I know that hand therapy is as important as the surgery itself with your recovery and your outcome. So there was no way that I would not do the exercises every single day. I was meticulous of doing all of the exercises, properly, doing the scar massage 5 times a day. Yeah, in the first few months, it was easily 4 or 5 hours altogether. Contrast bathing and various different things. But we did hit a brick wall through the first 6 months. I kind of plateaued with what traditional methods were achieving for me. There was scar tissue that was building on my ring finger, and therefore that finger wouldn't flex and bend at all. So that's when Gabby started to thinking of other methods, really, and thinking of what else could be done to try and help me to progress with the therapy side of things.
And that's when she found me, and and you were so lucky because Gabby had such a difficult task on her hands. Any therapist just rehabilitating flexor tendons, it's challenging enough. Now you combine fractures, nerve repairs, flexors, and extensors. And you also started rehab, because normally if you repair a flexor tendon, we'd begin the rehab within 3 days. And now you're already, 13 days down the line, even longer.
Yeah, sure. Yeah.
So she had done such an excellent job, but fortunately she was the type of person that didn't settle for what you'd achieved and didn't say to you, you know what, Stephen, this is it.
Yeah, every single hand therapy session that I even still have with Gabby, she's always proactively thinking of new things that I could do. How can I fix this? How can I find a solution to this problem? Not just settling. And like you said, finding that balance of allowing the structures to heal, but also doing the exercises and balancing the protocols with healing of the bones and the tendons was really, really tough.
It was really challenging.
She did a great job. She did a great job.
She did a great job. And so she reached out to me at that point because my specialty is the stiff hand and the casting motion to mobilize stiffness technique. And she presented your case to me, and the 3 of us met together for that first session. When you were first approached about using the Sims technique and using a non-removable cast, what was going through your mind? Did you think this is crazy, or were you thinking, okay, it makes sense?
Yeah, a bit of both. I did take some persuasion, I think, to come around to the idea of having a non-removable cast on my hand or on my whole wrist and forearm. It was, luckily for me, I don't need to drive for work. I work from home. So not being able to drive wasn't a big issue for me. not being able to play the piano, or because at this point I had started to be able to relearn trying to play the piano and getting back into things. So to then not be able to play and to stop that progress felt like, like a difficult pill to swallow, because it was stopping me. It was like going backwards with that. So that was more how I was feeling with Sims, but I understood how much it could help me. And it was like with Gabby and yourself showing me the progress that other patients had had with Sims. That was, I said, you know what, let's just go for it. Let's try it. I think the first cast that I went into was a 2 weeks non-removable. So 2 weeks is nothing for the permanent gains that the technique could have given me. So we went in and we had the Zoom calls together with yourself, Gabby, and me in the hospital. And Gabby was learning as well how to do the Sims plaster. But we went for it and we put it on, and it was heavy. And I did the 2 weeks, and I was doing the flexion exercises all the time in the cast. But to be honest, after a day or two, you get used to it, and it's not as bad as the mind thinks. Always most of the time our thoughts make things feel like they're a lot worse than what it really is in reality. Within a few days, I could see the progress as well, which makes you then feel motivated to keep going, and it was worth it. The biggest thing I noticed when I had the first Sims cast removed was the things that you can't see the progress in when it's on, which was the soft tissue. My hand just felt like a baby's skin. All of the heat from inside the plaster of Paris had been working over the two or 3 weeks, and all of the scarring felt really soft, and all of my skin felt like it had been massaging itself within the cast the whole time, and that was really a profound difference. So it wasn't just the exercising, but also the soft tissue benefits as well. And the way that my brain had started to bend my fingers in the correct order and pattern again. It was eye-opening when it was removed.
Thank you for mentioning that, because that's the difference between Sims and traditional therapy. If you have a thermoplastic splint, or if you go for massage, or if you're wearing silicone, or if you're having kinesio tape, or all these little tools and tricks that we have, that none of them are on or used long enough to get that impact. And only 2 weeks of just having that pseudo massage, you were able to experience that simply because you couldn't remove it.
Absolutely. And there was no effort needed. It took no time through my day. It was just on my arm. I think you told me once, it was like having a hand therapist on your arm 24/7, and it's completely true.
Yeah.
It had multiple benefits. So that one was actually bivalved. So Gabby had it cut and then straps put across the side so I could slip it on and off.
Yeah. That's great. So you were in it for 2 weeks and then bivalved, which is amazing, because with the extent of your injury, most patients have a circumferential cast for at least 3 months. It can be up to 3 months. So I think you showed great progress. Why don't you just show us your hand right now, Stephen, just so everyone can have a look at your hand and just see that's the level of the amputation. And then just show us your movement. That's incredible. Show us or simulate before Sims, how much movement did you have?
Oh, it was probably here, and it was all coming from the MCP joint here. There was barely any bend on the DIPs and PIP joints.
Yeah. You had a dominant intrinsic plus pattern of motion. So you were just using those powerful intrinsics to try and achieve that. But your ring finger was problematic. It actually lagged. So the index and middle progressed quite quickly, but the ring finger lagged.
Yeah. The ring finger wasn't responding, and I think nobody realized. We didn't really know why. We were trying to understand why SIMS was working for the two, but not so much. I mean, it did help, but it wasn't as quick as the index and middle finger. And when we studied the X-rays, and when Gabby and the surgeons and yourselves were looking at the X-rays, it was noticed that there was some twist on the bones where they'd re-healed, so that could have been influencing that finger. But also back at the start, when Gabby was having to balance the healing of the structures in the bones with the exercises that I was set, I think what had really happened was scar tissue had tethered the extensor tendon to the bone. So I had a Tenolysis surgery done in December 2023, and the Tenolysis released the scar tissue from the extensor tendon and the bone, and instantly on the table I was awake for the surgery. The surgeon passively bent the finger fully in, so it was fine. It would physically move. So that was the issue. It was scar tissue. So then after that surgery in January this year, I went back into SIMS, and I had needed no persuasion to go into SIMS from Gabby, because we knew the results that it had done in the summer of 2023. And we did the SIMS to help stop the scar tissue, to help keep the movement pattern of where the scar tissue would be trying to, again, rebuild in that finger after the surgery. And I strongly feel it's worked again. And now, from going from a finger that would barely go to bend here, is now almost in the same flexion as the other two.
It's amazing. That is just an amazing result. And I just want to...
And passively it will.
Yeah. And if you place and hold it, does it just spring up a little bit? If you place it there, can you hold it?
I can't actively hold it there. It springs out.
Spring out. How much sensation do you have in your hand?
I have full sensation in my hand, except for in the outside nerve of my index finger, which was the one that was severed with the blood supply and reattached. The finger has sensation here, but it's more like a fuzzy feeling around there. But I think the nerve from this side of the finger I think those fibers have kind of taken over a little bit, especially over on my fingertip. So I have good sensation on the index fingertip. It's more just on the side and back where it feels a bit like fuzzy. And I mean, otherwise, fully fine.
For a pianist, if you needing to feel those keys, so functionally, that's just incredible that it was,
so it took the index finger took a long time to gain control at the piano again. It was a little bit clumsy at times, and there's also some tendon issue going on with that index finger, where one of the pulleys was damaged, which is still ongoing. It's still there now, that problem. So with the piano, that finger did take a little bit more control, but I was determined to just keep going and get back to the piano and not let that small lack of control be a determining factor in playing the piano. I looked for the solutions to overcome it. Same with losing the little finger. I refingered passage work of pieces that I'd previously learned and performed to be able to play it without the fifth finger, and new pieces. Then the brain is so incredible. So many people have asked me, did you feel like you needed to use the little finger all the time when you're playing and accidentally try and play? But I didn't. Within just a week or so, my brain had already accepted and figured out that finger wasn't there, and I never accidentally tried to go for that finger. ever.
And
It was very, very quick.
you didn't have phantom finger either?
No, no phantom feeling. So I've been very lucky with that respect. I think the neuroplasticity of our brain and how we can learn new patterns of physical movement very quickly. And I think that's with the Sims as well, because it's forcing our brain to be blocked. It's forcing our joints to be blocked to make our brain use the stiffened joints. And it doesn't take long for us to get back into that pattern. Our brain adapts very quickly.
Amazing.
So that was very interesting for me to see how that happened.
Are you back playing the piano at full capacity and performing?
I am, yeah. So in April this year, I did my first professional recital again. It was very different to what I've usually done. It was at Durham University, and they asked me to do a combined recital but motivational speaking at the same time. So I prepared a video presentation with photos and slideshows and text about my accident going through whilst I played. And it went kind of at the same time, and I did some talking as well and played. So, and I've done a few events in a similar kind of way where it's a combination of playing and kind of motivational speaking, if you like. I don't really see myself as that kind of person, but it's a door, and it's a door which is opened, and I've been asked to do since my accident. And I've been doing some traditional recitals as well. I've got a recital coming up in a couple of weeks from now in Chelmsford Cathedral. So yeah, going back to playing the piano was something which has really been a blessing for me, because when the accident happened, I didn't know if I'd ever be able to play again. And I was always positive. I've never focused on the negative side of what I've lost. I've always focused on how lucky I've been ever since the neighbour's back door was open and her dog was in her garden, through to the surgery, through to meeting Gabby and yourself and the Sims technique. And all of these factors have been things to be grateful for. And the fact that I've kept my other fingers against the odds, really, and the leeches has always been a positive for me, rather than a negative.
It's incredible, because I believe in every injury there is a gift. What do you think that gift was to you as a result of this injury? Apart from gratitude.
Well, yeah. I think, without sounding cliche, it definitely makes you realize how lucky you are every day to have the things that you do have, and not to focus on the things that you've lost or don't have. I think in terms of, as in my career as a pianist, it's given me a motivation to explore different avenues that sets me differently and aside from other pianists, and to persevere with, the challenges that you face. There's always a way to move forward out of the dark place, and that's definitely made me grow as a person. Yeah.
That's amazing. Yeah, because exactly with your work and your career, had you not had this accident, you would never have had those doors opened. It just wouldn't have needed, they wouldn't have needed to be opened.
Yeah, definitely.
I can speak from experience as well, having had quite a severe knee injury this year. And it opened so many doors for me, not just in the healing journey and where it's actually taken my practice, but also in my perception of healing. I think that there can be a very centralized approach to healing and then a very decentralized. And only when you're thrown into the deep end and you're forced to heal, do you start believing and even absorbing that kind of more decentralized approach.
Yeah, definitely. One thing that I've also noticed within myself since my accident is that because I also like to do diving as a sport, just recreationally. And I'd always for years be scared to try something new, or I'd sit in my comfort zone.
Yes.
And now I push myself and I stretch my comfort zone, because if you sit in your comfort zone and believe that this is all you can do, then that is what you will stay doing. And if you always just try to step your toe out of your comfort zone or consistently, then your zone is growing all the time. And I started to try new dives that I wasn't willing to try before, because if you say, I'll do it tomorrow, next time, there may not be a next time, you just gotta do it now.
It's got to dive in. It's fun.
Dive in. Yeah.
That's brilliant. I think you sharing your story is so valid, because it's a lesson for all of us. Why procrastinate? Anything can happen at any time, and we've got to seize opportunities.
Absolutely. Yeah.
So where to now? What more do you feel you need to achieve with your hand, your rehabilitation? Where are you at the moment?
So my hand isn't perfect. Throughout my journey and my experience, my injury, it's been very difficult for medical professionals to really predict an outcome, because it was very complex and everybody's different. Age, whether you smoke, your general health can all determine how much effort you put into hand therapy, if you've had SIMS or not. All makes a big difference. So now every medical professional throughout my journey and my case has been so really impressed. They almost think it's a miracle how my hand is. It's not perfect. There are some callus in my bones. There is some issues with my tendon on my index finger where it bowstrings forwards and is slightly out of line. But given the circumstances, when I saw my fingers hanging off in my garden and my little finger on the floor, I think it's fair to accept that it is a miracle what has been saved and the way my hand is now. I mean, I was very self-conscious throughout 2023 of how I looked and how my hand, worrying that people would notice my loss of my little finger, but actually it's all worry in your own head, and people really don't care. They might notice, but they're not that important to people. They don't care. And it took me a long time to realize and to accept that. And now the next step is to accept that my hand isn't perfect, but be positive about how successful all of the treatment has been with what was saved. With regards to a prosthesis on my little finger, it's something that I've thought about in the past. But again, I haven't felt like I needed it functionally, and mentally I've accepted that this is me now. So I don't have a prosthetic little finger.
That's so beautiful. Can you tell us a little bit about your surgeon's opinion of the SIMS technique? Did they know about SIMS? Are they now an advocate for SIMS?
Yeah, so it's difficult for me to give a full opinion on what the surgeon doesn't know. But what I do know is that in my hospital, Gabby was really, really pushing for SIMS to be, and she still is, really pushing for SIMS to be more widely used by the NHS in our hospital trust. She'd heard of the technique herself, and she trained with you, and she knew that this technique probably would be good for me. So I was the first person to have experienced the SIMS technique. And she worked a lot with my surgeon. She attended and watched my Tenolysis surgery and has presented. Gabby's done a lot of research and put a lot of time into writing up my case and presenting it to all of the surgeons. In fact, recently, I think last week, Gabby did a presentation of my case to all of the doctors and consultants for hand surgery in our trust, and it was focused on Sims technique and how the benefits have improved my outcome. And she said to me that the surgeons were very impressed. So I don't know how much the surgeons know, but I do know that they are impressed by the results of what they've seen with Sims, and it's been promoted a lot more. And Gabby is doing a lot of promotion to help, and I think she's using the Sims technique on other patients now as well in her practice.
Yes.
So it's thanks to you really, and to Gabby, for helping to push that to surgeons, to patients, and other hand therapists, because I don't think it is used as much as it should be.
Yeah. And it's often used too late. You know, it should be used sooner rather than later. And I think that was always my vision and my goal, was to, you know, before I developed the course, I could impact the patients that came to my practice. Once I had done the course, I could impact patients like you and reach out and be there in your treatment room and be part of your journey. And that's what just adds so much value to my day. It's just incredible. So from a perspective, just in case patients wonder, how did you feel having me in the room? It was just quite conversational, wasn't it? It wasn't.
Yeah, it was definitely, it made me feel reassured, because having you from in South Africa on a laptop in the room where my cast was being put and Gabby there, I just felt like I was in safe hands, excuse the pun, because we were able to talk to each other, ask questions, chat, and it just felt really comfortable. And I think having it online was really easy to use. You know, it was easy for me to ask questions and for Gabby to ask questions and to learn on the spot. And even though it was a video call across, you know, the world, there was a time when you said to Gabby, "Oh, I think maybe you should take it a little bit lower on the fingers." You know, it was that detailed. So it was amazing.
Oh, no, thank you. And I always feel so grateful for impacting and being part of the rehabilitation process. So I just want to thank you for sharing your story with us and for going into the details, which I'm sure are really difficult to talk about. I'm sure it must trigger some bad emotions. So thank you for going down that path to share, because I'm sure there's going to be a patient lying in a hospital bed somewhere in the world that is searching for reassurance, searching for an option that is available to them with a similar injury. Sore injuries are quite popular, unfortunately, or common, I should say. So thank you, Stephen, for everything and for being part of this.
Yeah, thank you so much. I mean, like you said, if it can be helpful to anyone who has the worries that I had, then there's always a way. There is always something that can be done. And Sims is one of those big things. So just go for it.
And before we sign off, I think one last thing I just want to say is it's long lasting. You've never regressed. You've always been able, whatever you've gained, you've kept and gained more.
Yeah. Never regressed, no.
Yeah, that's what's so lovely. Well, I look forward to attending a concert in person. So please let me know I'll let you know when I'm around, and I would love to meet you. And
I would love you to. Yeah, Gabby's coming to my one in October, actually, in Chelmsford Cathedral. So that'll be really special to have her there. So she can see where I was to where I am now.
Incredible. I just wish you every success in your career, and I'm going to look forward to following you to see where it goes.
Thank you so much.
Thank you, Stephen.